I'm going to provide a brief update on the work of the Alliance's bereavement workstream. I want to specifically talk about the online training workshop we've developed and the bereavement services directories that have been created and are now hosted on the Hive and Connect for Hampshire websites. It's really important to share this with you as a group because the Alliance is key in supporting and promoting these resources. So I've recorded this presentation so that I can build into it some video of the website and the links out to the directories so that you can see those in action. So as I've probably mentioned earlier in the update for the bereavement workstream, there are three key focuses of the workstream. It's recognising and responding, so that is providing this virtual bereavement training to frontline health, social care, third sector professionals, any organisations who are likely to be encountering more bereaved people who may be experiencing an increased complexity in their bereavement. And alongside this, we want to provide this online signposting resource so that we're basically covering the two levels. We're giving more people more skills to feel more confident in supporting people, but when they recognise, and that's a key part of the training, that somebody needs further support or more skilled support, they'll know where to signpost them. So these resources have been created for that. And alongside that, local charities and organisations and bereavement services continue to link in and monitor demand. And again, the Alliance is key in being a forum for that, in sharing the different organisations' experience of bereavement and other mental health difficulties at the moment. So I just wanted to ever so briefly recap why bereavement is such a key feature in understanding how we need to respond to the COVID crisis. So it's a well-established fact in the bereavement literature that there are an interaction of factors that can make grief more complicated. So these are individual factors like personality, including personal resources and resilience, life experience such as past trauma, impact of cumulative loss, or existing mental health difficulties. Then there's the person's environment. So that's their support networks, their family dynamics, their financial resources. And then there's the nature of the death, whether it's traumatic or peaceful, expected or sudden, where it falls in the age of the person. So as we immediately can see, every single one of these factors are likely to be impacted by the COVID crisis. So thinking of individual factors, if people have any pre-existing vulnerabilities, they're going to be more triggered, more heightened by the isolation, by the worry, by the anxiety, by all of these factors coming together. If we think about the person's environment, somebody who is grieving will be grieving very potentially with a lot of their support networks cut off, without being able to travel places to see people, without being able to hug people, without being able to just sometimes go around to a neighbour's house. And then absolutely pivotally key is the nature of the loss, the circumstances of the death. So we know that there will be people dying in hospitals, in nursing homes where visiting is just not possible and hasn't been allowed, and the impact of not being able to be with a loved one at the end of their death is potentially profound and potentially conflicting for the bereavement. So the research, though, into actually what the impact is only just starting to emerge now. What it's shown so far is that there is a greater intensity to people's grief when they are bereaved during the crisis. Some of the research has shown that if you're bereaved previously and you were in a process of grief already, we're not necessarily seeing a spike in that grief, but if you were bereaved during the crisis, with all of those factors that we've just talked about, we're seeing a greater intensity. What the research is only just starting to look at is whether there are compensatory factors that may be at play which might offset some of that. So we don't know yet. The picture is still beginning to emerge, but we absolutely want to be ready. And actually preparing directories of services, preparing training for people so that they can feel more comfortable and confident in managing grief is, COVID crisis or not, it's a really important skill set that we need society to have more of so that the bereaved people can feel more supported. So I'm going to show you the website now. At the website, if you go across to the Rowan's Hospice website, it's in the Professionals tab and then in Education. And you can see here towards the top of the page, we've got the main link to the page. The page was paid for by Portsmouth and South East Hampshire CCG, who commissioned it, and the Rowans had it built. And we've got the learning outcomes listed near the top of the page so that managers or organisations can just get a really quick sense of what it will be teaching, what the investment of their time will be, and then descriptions of the format of the video and a download that contains some of the key slides and some of the case studies that are in the video, which I'll show you shortly. And then the video is here embedded in the web page. You can just play it in the web page or watch it through onto the YouTube page by clicking onto the link there. But beneath it, because the video is 2 hours 20 minutes long, and then within that there are 6 or 7 opportunities to stop and work on exercises, either on your own or in a group of people, if you're able to be in a group of people. So it could run up to about 3 hours with breaks and things like that. So it isn't a kind of shortened light version of the training. It is kind of a full workshop that we would run for people at a full length. And because of that, we've also built in the sections. So we've broken it down into 3 broad sections so that people can jump in and out of it and just jump to the links. And you can see the overall content structure, so the introduction, the definitions, the models of grief, so we can understand the patterns and what people experience, some of the complex reactions to grief and the complexity, levels of complexity that we've just talked about, and looking at the impact of COVID, case studies, and then finally moving on to actually how we support the bereaved, being alongside grief. There's a role play using some of the supportive skills, a few notes on self-care, and some final comments. So that's everything in there. I'll show you the download. So yeah, you can see we've got the case studies. There's 3 case studies, each applying to a different level of complexity to give people some opportunity to think about that when they support, when they refer on, what they'd be worried about. Key slides on the stages and how people move forward. And some of the risk factors around complicated grief. I think nice guidelines on that. So these, and this slide here I guess is showing exactly what we're trying to target here. So this training is targeting this level 1 support. I'm about to show you the links to level 2 support, and it's also recognising when there may be the need for some specialist support. So if we come down here, connect to the second page, bereavement, support when to refer. We've just given some explanation of the levels here, level 1 being this training, level 2 with the links to Hive and Connect for Hampshire, and then some details about how people might access level 3 services. So if I just show you the links here, you can see the bereavement support directory here on Hive, which is searchable, so you can use the search links and the full directory will come up of all of the different services that are available. That's a link to the full list of them here. And then again here on Connect for Hampshire, all the services there again listed. And this has been a lot of people working on this. So Shirley Stout, Jane Leach, Joe Atkinson, Gina Nash, Caroline Howarth at Hive. That's the work of a lot of people. That is not my work. I barely lifted a finger to do with the directories whatsoever. So that's lots of people who've been working on that. So yeah, they're the key things to demonstrate for you. So then just to briefly show you some of the tasks, the exercises we've got people to do. So it's things like thinking about the different types of loss so people can understand how grief and loss and bereavement, the process of grieving, applies to so many different aspects of life and our experience in life, using videos like Pixar's Up to consider what loss looks like and how people adapt to it, and dreams and hopes shift and respond to different losses over time through the course of grief. And then just, a really key slide like this, like just having people stop and think, what is it that is their puzzles and their worries? What do they find really difficult about the thought of supporting a grieving person? And I should mention that one of the offers in the video is that if people still have puzzles at the end, they can contact my service and book in like a half-hour Q&A session. We're hoping we can gather groups of people together if there's any interest for it, so that if there are any remaining puzzles or people just need some help applying the theory to their actual practical situations they're encountering, we can support them in that. So yeah, the case studies are discussed with my team in there, and then ultimately we come on to some slides on how somebody creates a helpful listening space, keeping it just very straightforward and human and simple. Because the ultimate message we want to get across here is summed up by Earl Grolman here. Grief is not a disorder, a disease, or a sign of weakness. It's an emotional, physical, and spiritual necessity. And the key bit being that the only cure for grief is to grieve. Or we might say the only cure for grief is to be allowed to grieve. And a lot of this training is about how we allow and support somebody in their grieving. And one of the slides I use in there, which I'll end on here, is from something that somebody said to me. This was a person who was grieving for their own dying, a 32-year-old woman with a life-limiting illness, who said to me that I don't want people to keep rushing in with solutions, trying to make everything okay. It just makes me frustrated and sad that they haven't heard what's going on for me. They can't take my pain away. They can't take my fear away. What I need is someone to walk beside me. I need to know that they really hear me. I want to feel that they're genuinely present with me. Then I can feel less alone. And if we can achieve anything in just helping people be more confident to just be alongside people, then that'd be a good day. Okay, thanks very much.